Good evening, everyone. I'm so happy to see you tonight, and I'm really glad you joined our Zoom because this is an important topic we all need to understand, whether you need it or whether your family member needs it. We will be sharing some simple things that will help to keep you well during this difficult time. Simple remedies are sometimes called old-fashioned remedies. Maybe you've got a special remedy from your grandmother and she learned it from her grandmother going clear back. But our question is, are they effective? Do they really work? Are they scientific? Yes, the ones that we are going to be sharing tonight are scientific and they are excellent, very effective. One can vigorously fight the disease, or you can more gently deal with issues according to the overall health of the person that you're working with. We're going to talk about hydrotherapy tonight. Now, hydrotherapy are water treatments. Hydro means water, and it's using plain water in very effective ways. Tonight, we're talking about your immunity so you don't get sick. Or if you do get sick, maybe hydrotherapy can be used to help your body heal itself. I want to assure you we are not against doctors. My mom and dad were both doctors. I grew up in a medical family and have been around medicine pretty much all my life. We need doctors who are skillfully trained, and we want to take personal responsibility for our medicine. Some people, all they want are pills. They go there to the doctor and they're dissatisfied if the doctor tells them anything but hand them the pill. That is not the best way. They just want an antibiotic or pain medicine or whatever. But we want to keep our medicine use as low as possible because there is drug resistance. We must never, never, never self-prescribe or use anyone else's drugs. Doctors understand the inner working of the different drugs, of how it works back and forth. And you could be in big trouble with side effects if you took somebody else's medicines. So try and save medicine for serious disease. Hydrotherapy was popularized by a Dr. John Harvey Kellogg, who worked in Battle Creek, Michigan, and set up a sanitarium system that was the wonder of the world. In 1866, the Western Health Institute was started out by somebody else. But when Dr. Kellogg took it over, it went from big to huge. In 1902, unfortunately, that sanitarium burned up. And it is said that Dr. Kellogg was not in town at that time, but he got off the train with plans under his arm and he was ready to start and build the next newer, more beautiful sanitarium. Here, he talked about health. Now, a hospital today, you go there, you're sick, you go in a bed and you stay in bed until they give you medicine or ventilators or whatever has to be. Sanitariums work with your health even before you are seriously ill. Now, a sanatorium was a health spa for individuals like with TB to go to regain health. But most people didn't regain it because TB was such a terrible disease. Dr. Kellogg changed the name from sanatorium to sanitarium. And Battle Creek was the first sanitarium, and it was a first-class hospital, but used natural treatments to cure disease. Surgery was also included, but it was much more than just surgery. It was also a huge place to learn better living. Dr. Kellogg gave lectures, people learned how to breathe, exercise, eat. It changed their life forever, and that's what a sanitarium will do. One of the things that Dr. Kellogg dealt with was skillful use of water. Now, here's a bunch of pictures of how they used water in those days. Here's a light treatment. Here's a tub treatment. Tonight, we'll be getting into a little bit of that. He always believed that patients should be in fresh air as much as possible. Now, today you go to the hospital, you stay in a room that's usually sealed off, all air conditioning. Oh, in those days, they would bundle them up, put them in a wheelchair, take them out into the sunshine, take them out into the shade, just take them outside to get the fresh air into their bodies. At the SAN, food was prepared simply and deliciously. And look at the beautiful display of tableware that they had. It was delicious vegetarian food that would help build the system up and not tear it down. He believed in exercise, whether doing calisthenics or walking or biking. He himself always rode a bicycle. It's said that he wore this perfectly white suit, and he would bike along, and his stenographer would run alongside taking notes on his dictation, on his book that he'd be working on. Quite the character, but that was Dr. Kellogg. So fresh air, exercise, wonderful food. It was focused on living right. So what are the advantages of hydrotherapy over other things? It helps build the immunity so the body can fight its own battles. It's easy, it's cheap, there's virtually no adverse side effects if followed correctly. It can treat a specific body part. Say I had a splinter in my finger and my finger is infected. I don't have to take an antibiotic for that finger because I can put it in hot and cold water until it gets better. So you can focus in exactly on the body part you want to treat. There's no toxins or waste products, so it doesn't overtax the liver or kidneys, and it helps eliminate the toxins by increasing the body's metabolism. It imparts a sense of well-being. You feel better after you've had a bath or a shower like that. Whole point of hydrotherapy is to prevent, but if one does get sick, use natural means to cure. Battle Creek served so many people that they got very skilled at times, temperatures, exact treatment modalities. And there are many books today that come from that time, or even our time. And all these home remedies books are really very excellent. But there's a website that you can write down and have accessible to you right now. It's called traditionalhydrotherapy.com or hydroforcovid.com. Both those websites are based on Kellogg and Abbott and are very, very good because they have little clips of how to do things, and it's just excellent. So the problem starts with germs. A mighty creature is the germ, though smaller than a pachyderm. His strange delight he often pleases by giving people strange diseases. Germs are everywhere. And we often say, wash your hands, cover your mouth, be careful in social situations. It's not a time nowadays to hug or to be cozy. And wear a mask. A mask is natural. It helps because it keeps you from spreading your germs to everybody around you. Cover your mouth, think of others. Germs go everywhere. Now you can use a tissue or a sleeve, not your hands. A lot of people, when they go to sneeze, they hatchoo right into their hands, but then what are their hands full of? They're full of germs. And you go to shake somebody's hand, guess who gets the germ? So if you have a tissue, go into your tissue, or if you don't have a tissue, use your arm, hatchoo right into the sleeve of your arm. Mask up for others, be unselfish, think of other people, and wash your hands. Just know that your hands are full of germs. Why should you wash your hands? Look at this picture here. This man is blowing his nose. Then he goes and shakes this lady's hand, and then of course she is getting the same thing. How do we wash our hands? We take and we wring our hands, sing happy birthday. That's how long we should be washing our hands. Notice this picture up here. Do you see the red spots? Those are the parts that we typically do not get clean. So that would be left hand, right in the thumb, and between the tips of the left fingers, between the arms, between the fingers, and on the other hand, between here and between here. So you want to make sure that when you're washing, you are completely getting everything, and take your time and get your hands really clean. If you don't happen to be where there's a good way to do it, no water, no soap, use hand sanitizer in the same way. We're trying to get the same areas that are very difficult to keep clean. And then try not to touch your face. It's very hard. I know I have a hard time sometimes, but keep your hands down off of your face. Let's take a look at how things are spread. There are different kinds of organisms. Bacteria comes in things like TB, tetanus, earache, and that's spread through air or dirty wounds or common cold. And that's when antibiotics are really helpful. Viruses, on the other hand, are different than bacteria. They come in colds, flu, measles, chickenpox. COVID-19 is a virus. In fact, people call it the virus. And you get it spread from somebody sick, coughing in the air, touching a face, touching a pew at church, touching a tabletop. And medicine that is most effective right now are the vaccines, and that is to help you keep from getting it in the first place. It's a very controversial thing. Some people don't want to do it. Personally, I think it's a really good idea, but it's a personal decision. But that's the only thing right now that's keeping people. Fungus is things like athlete's foot, jock itch, and by touching or even by clothing. You use different kinds of ointments to get that done. Parasites are internal or external. Internal will give you diarrhea, dysentery. External are lice in your hair. And how do you get those? By somebody else's comb. Feces to mouth, lack of cleanliness, contact with people or clothes. And it's the way you take care of it is by poisoning the host by an insecticide, or ivermectin is the big kind that's being used these days. I'm going to tell you 2 things you can do to build your immunity. And if you do these every day, that will help a lot. Practice deep breathing, especially in the open air. Remember Kellogg's thing, and do contrast hot and cold showers. So here is how to breathe deeply. Notice on the left-hand side, you have the outside and inside. And notice that coming in through the mouth or going through the nose, all go down into the trachea or the windpipe that goes on down into the lungs. So we want to learn to breathe with our nose, not our mouth. Most people leave their mouth open and they're breathing through their mouth all the time. We need to learn to close our lips unless we are eating or speaking. Nasal breathing increases nitric oxide production in the upper airways. Nitric oxide assists in the defense against airborne pathogens. So we purse our lips and we go for it. Mouth breathing allows for many more dust air particles to come in and bypasses the nose filtration system. The nose was meant to breathe. It has many filters in there that are natural, cilia, all the rest. In the mouth, it's not meant to. There's only the tonsils down there that can do filtration. So our breathing habits can increase or decrease our risk of respiratory infection. We can build our lungs ahead of time. Deep breathing builds oxygen levels and our lung capacity, all really important these days. So use your diaphragm. Diaphragm is below your ribs, and you can put your hand right there. And when you breathe in, it should go out, not in. So learn to diaphragm breathe. And this is the a really good link that you can look more. Now, we can also recommend a hot and cold shower. Every night when you take a shower, you can end up with cold. And here are some things that you should know. We can shower with abrupt changes from hot to cold, and that is used to boost our immunity. Hot expands the blood vessels, cold constricts them. This makes the blood flow much more quickly. This boosts oxygen and nutrients to all the body cells, enhancing immunity. It increases the white blood cell activity, which arms the body so it can fight its own battles. So here's my granddaughter, and actually my two granddaughters are going to.
Our granddaughter, and she is going to be demonstrating the hot and cold shower. Her sister, Sarah, is going to be running the controls on it. And so go ahead and turn it hot all the way around.
She can go all the way hot. I go all the way hot. I love it.
Okay. Turn around. Right up, keep under the
Into the water.
But don't get her dizzy. Normally we would go 3 minutes of hot and 30 seconds of cold. All right, Sarah, please turn it to the cold.
I'm looking forward to cold. Keep turning around. Oh my God, it's turning cold. Is it too cold? No, it can't be cold.
You guys are so tough.
I wanted to scream.
Is it cold?
Yeah, freezing. Feels like I'm in an iceberg.
Okay, turn it to the hot. Now, if this was an infirm person, you would not make them stand, but you would make them sit. So, Annika, sit on the bench there. Like that. You would make them sit. And then it's because sometimes one that is very weak cannot stand and they get dizzy. So we will sit her like that for a while. All right, are you getting hot?
Yes.
Very hot?
It's not too hot. No, I turned it off.
Okay, can you turn so your back is to the shower, honey?
Yeah.
There you go. And back up a little bit more so you're more under the shower. There you go, just like that. Is that cold?
Yeah, it's cold.
Okay. If it's too cold, then you can usually heat it up just a little bit so that it's bearable for the person. All right, now I'll turn it to the hot. We're going to say this is 3 minutes and we're going to put it back on the cold now, please. Right there. And we will finish off with the cold. And as soon as we're done, we're going to towel off, make sure that we're really dry, and then go to bed.
So here we are, resting in bed for at least 39 minutes, best if all night long. Now, extremes of hot and cold should not be used with elderly and feeble or very young, diabetes where feeling is not good, heart disease, kidney failure, severe arterial sclerosis, hyperthyroidism or goiter, hypertension, neuritis, or rheumatoid arthritis. All of these are feeling impaired, and they will not be able to tell you if it's too hot or too cold. So don't go by patient sensation with these. Make it a more gentle contrast. Now, that is for if you're feeling well and you want to stay well. But if you start feeling the least bit sick and think, I think something is coming on. Oh, I've been more tired than lately. I have a little sore throat. I have a cough. I have a fever, maybe a runny nose all the time. Something is happening. Don't wait. Immediately do a hot tub bath. Not a contrast shower. It's too late for that now. Go to a hot tub bath. And my friend Bruce Thompson from Australia is going to be sharing how this is done.
These are instructions on how you can have a hot tub bath in the comfort of your own home. Firstly, while the bathtub is running, drink some warm water to warm up your body. Then put some ice into a big bowl and pour some water into it. Have a hand towel ready to go. And prepare your bed because after this treatment, you want to immediately go and have a rest in it. Before going into the bathtub, make sure you go to the toilet so you do not have to go during the treatment. Put the bowl of ice next to the bathtub. Make sure the bathroom is nice and warm. Before getting into the bathtub, make sure you check the temperature with your elbow. It should be just a bit hotter than you'd like it to be, but not too hot that it burns your skin. It is now time to get into the bathtub. Because we are mainly trying to treat the chest, make sure you can get the chest under the water as much as possible. Make sure you keep your head out of the water and keep your head cool. Keep your head cool by placing the cold towel onto your forehead or over your face. You may also use a pillow to keep your head comfortable. Make sure you have a watch or a timing device because you want to be in the bathtub no longer than 20 minutes. While you're in the bathtub, you may find yourself getting sweaty, and this is good. Keep using the hand towel on your forehead to keep your head cool. After the 20 minutes is done, you want to let out the water and stay in the bathtub. While in the bathtub, you want to use that hand towel and wipe down your limbs. This is called cold mitten friction. The hand towel will be very cold on your limbs. However, what's coming next will be more of a shock. You want to pour the remaining of the ice cold water onto your chest and onto your back. This will definitely be a shock to your system, but it will be very, very refreshing. Slowly get up from the bathtub. You don't want to go too quick because you may be lightheaded. Dry yourself off and then immediately go to bed. You need to rest for at least half an hour minimum to get your body back to normal equilibrium. Or you can sleep for the night. I hope these instructions have been helpful for you.
So let's just do a quick summary. How do we prevent disease with hydrotherapy? First of all, we want to drink a lot of water. We want to get moderate, not heavy exercise. We want to deep breathe with our lips pursed, not breathing through the mouth. We want to do a cold ending on our hot showers just to rev up our immunity. Go to bed early, get good sleep. But if you're coming down with something, do a hot tub bath now. Don't wait till you're feeling miserable. Just with the earliest symptoms, start doing a hot tub bath. It can't hurt and it can help a lot. Here's something you can look at to learn more if you're interested in hydrotherapy. The biggest thing for us to realize is that God created us and he wants to preserve us in good health. And prayer is a very important thing. So with all of our treatments, we recommend praying that God will bless that treatment on either myself or whoever I'm helping with. Great having you with us tonight. Try and come back Thursday night because we will go more deeply into all of these things at this time.